All right, we are recording. Well, welcome to this episode of the Counselor's Bookshelf. This is recorded for the Theories of Counseling course, and I am here with the soon-to-be Dr. Captari-Scirri. And we've known each other for quite a while. Has it been over 10 years now?
Over a decade, yes. And what a joy it has been.
Over a decade, and it has been a joy. It has been uh, Dorin is someone who has inspired me greatly, and has been a real joy to be a part of his journey and have him a part of mine. Um, and Dorin has a lot of training in both CBT and DBT. And will you tell us a little bit about your current role?
Sure. So in my full-time job, I worked as what is called a blended care provider um, for Lyra Clinical Associates. So I provide counseling in online format and specifically utilize cognitive behavioral interventions. Um, and in my private practice, I see also a few clients where I get to combine CBT with other orientations that are more suited for client presentation, but also more aligned with who I am as an individual. So what I like about the different roles that I have is that I can think about what is needed in the space that I'm in, so that I can utilize that particular intervention or modality with intentionality.
It sounds like an exciting place to be able to use things that are congruent with your approach, and also have the opportunity to apply a lot of CBT. And in the past, you've used DBT. Um, so, will you tell us about some of the common misconceptions about CBT?
Yeah, as misconceptions that I've had even prior to starting this role, that CBT is very simplistic, that is just about, just change your thoughts and that's all you have to do. And the more I've been learning about CBT, the more I've grown to be fascinated with how complex it is, particularly when it comes to case formulation. So understanding how core beliefs are associated with assumptions and rules, are associated with automatic negative thoughts, and different ways to intervene either behaviorally or cognitively, and the intentionality with which we would intervene pending on kind of what the target or the focus of treatment is. So I really wish that during my counseling theories course, when I was in doing my master's, I would have appreciated more and read more on CBT. I think I played it down a little bit because I did not fully understand how rich it is and how much it can offer.
Okay, so it sounds like as you've learned more about it, and when you think about the core beliefs, there's really more to dive into. It seems a little deeper than maybe the overview from some theories textbooks might convey.
Absolutely. For example, whenever I would try to do some kind of CBT intervention, I would go immediately to challenge a core belief. And I would always wonder, like, why am I getting stuck? Like, why is there so little movement? And it's only been in the recent months that as I've been reading more, that we want to start with the automatic negative thoughts first. And maybe we go for rules and assumptions. Core beliefs are part of somebody's structure and the way they view themselves in the world. And to try and change that with a simple intervention, um, it makes sense that would be hard and would be challenging. So honoring the process and honoring the role of core beliefs is something that I wish I would have understood earlier on when I was just learning in broad terms about CBT.
That makes a lot of sense what you're saying, because when you're talking about core beliefs, the other words that come to mind are worldview, or what attachment theorists or object relations theorists might call internal working models,
Models.
right? Your
Mhm.
beliefs about yourself and others and the world in which we live. And I just think about, the relationship rules, as Clinton and Sibsey call them. If there's secure attachment, there's the belief that I am worthy of love and others are competent and able to show love.
Mhm.
But with the other styles, there's a breakdown in those beliefs. And those are such personal beliefs about whether we're worthy of love and about whether others are able to love, to be able to kind of work on modifying them or adjusting them, or discussing, having a challenging discussion about them. That would be tough to dive into. I think with the counseling skills, that seems way down the road into reflecting meaning, exploring meaning, what something means to a person. So I really appreciate you clarifying that misconception. And one other point that really comes out from what you said is this idea that one of my mentors taught me: don't ever leave your education up to the university or your
Mm,
assigned textbook readings. That's only a starting point, but
mhm.
dive in and do additional readings. And it sounds like if you could go back and talk to your former self, you would say, "Hey, Doreen, read some of these key textbooks and read a little bit more." So that's a good segue, though. You recommended, I asked you what were your favorite CBT books, and which ones were on your list?
Yeah, so I think I would call it the CBT Bible, if you will, the Cognitive Behavioral Therapy Essentials by Judith Beck, second edition. I actually just recently
Oh, so
reread
it's
it.
different than this one then?
No, it's that one. Oh, it's third
Oh,
edition. You're
third edition.
right.
Okay.
Yeah. No, it's good that it's the third edition. It's even a more recent one. So third edition is a great one. It just gives a overview of cognitive behavioral basics in terms of case conceptualization, interventions, treatment planning, everything that's necessary. I really wish I would have read that book early on.
Mm,
The other one is the Feeling Good Handbook by David Burns.
David Burns. This has been around a while. I think it came out in 1980. So was it over 50,000, a million copies sold? I can't remember, but definitely been around the block a little bit.
Yeah, I know it's a thick book, but it is an easy read, and I like David Burns' style because it's so accessible both to clinicians as well as to clients. I've recommended this book to clients just as an adjunctive way of them understanding what we're
Mm.
doing in sessions, and they were so receptive to it and really enjoyed that it's not clinical jargon, but it's something that they can easily digest.
Okay, so it's user friendly for the client. That's exciting to hear. Now, have you read one called by David Burns called "Feeling Good Together"?
No, but I've heard that it's such a good recommended reading for doing couples therapy and using a cognitive behavioral frame.
Even for individual, I think it's really even more necessary for individual before you go into
Yeah.
couples, because it helps people take responsibility. And
Hmm.
only wish I had read it earlier in my life, like you said about that one. So I definitely recommend that. And I think there was one more on your list, right?
Yeah, so this one I just recently started, Acceptance and Commitment Therapy, or ACT, Stephen Hayes. It's a really good book that kind of highlights some of one of the third wave CBT, a CBT that takes into account not necessarily as much the importance of changing thoughts, but changing our relationship to our thoughts.
Mm,
And also really focusing on engaging in actions or behaviors that are aligned with our values, aligned with what's important to us.
alignment
So,
and congruence, it sounds like.
yeah, exactly, exactly. So when I think about congruence, I of course think of Carl Rogers,
Yes.
and to look at ACT right now as integrated with that understanding that the more congruent we live, the healthier we are, the more adjusted we are. It feels exciting.
Yeah, it is. It's exciting. And I can't help but think how blessed and fortunate your clients are to have a therapist that is so well trained in Carl Rogers' approach and the counseling skills and congruence and unconditional positive regard, and then putting that together with CBT, and being able to have a prizing approach, demeanor, way of connecting with your client. I can imagine would only make the CBT so much more effective. But speaking of these different approaches, you've also done some DBT work. So, what would you say are some of the key differences, or what may lead you to decide to do DBT versus CBT with a particular client?
Yeah, it's a great question. So DBT would also fall in the category of a third wave CBT orientation. One of the main differences between cognitive behavioral therapy and dialectical behavioral therapy is dialectical behavioral therapy has a stronger emotion-focused theory and focuses on behaviors or changing behaviors related to emotional dysregulation. So if I'm working with clients who present with a problem that has that component, emotional dysregulation and behaviors related to that, I might be more inclined to discuss with them the value of looking at dialectical behavioral therapy. And dialectical behavioral therapy is complex and it has many parts to it. It has skills training, it has individual therapy, it has a consultation team, has phone coaching. So even when making that decision, often I like to go back and realize like, well, I think I'm going to inform my treatment from a DBT standpoint model because as a sole provider, I'm not able to provide the entirety of the components of DBT, but the way we look at what the client is presenting with will be informed through that lens.
Okay, so it does sound like, as you talk about the components, that although CBT may be more complex than most people may believe, DBT has even more moving parts to keep track of. So that is part of the consideration as well. And I know we are getting to the end of our time here. So, any closing thoughts that many of the people that may be watching this will be counselors who are in training, who are learning about theories. Do you have any suggestions or advice to them as they go, or any key resources that you'd recommend that they, maybe a must have for every counselor's bookshelf as they go on in their journey of becoming?
Yeah, I like this question as well. I know we're talking specifically about CBT, but a book that was formative in my counselor development was The Gift of Therapy by Irvin Yalom.
Mm.
And as you know from our previous work together, that book inspired me to want to read all of his work. And I connected so much with his therapeutic presence. Regarding CBT, the books that you just highlighted are, I would say, must have. When I think about my own journey of connecting to a theoretical orientation, I used to think that it's an easy task. I just choose something and I go with it. But even over the last 5 years, I found myself really working at integrating different modalities, different theoretical orientations with who I am as a person naturally, and finding and fine tuning that in my works with clients and being open to the feedback that clients have. There might be some clients who want more structure. So when I work with clients that wanted that, taking a non-directive approach or variant style, even though felt comfortable to me, it would elicit a lot of anxiety for the client. So bringing a modality that's more directive and more structured, such as CBT or DBT, had therapeutic impact, had therapeutic effect. And other clients, they don't really like this being so hemmed in by agenda setting and doing all these interventions. So being willing to still use those interventions, but go back to the Rogerian style is also useful. So I would say, try what works and be receptive to feedback from supervisors and from clients. And any intervention that you use it with intentionality, and think about the rationale of why you are taking a particular approach.
So it sounds like you advise people to welcome feedback from their clients and check in to see how things are working, if they prefer more or less structure. I can recall a particular supervisee I had that said, I'd like it if we could have structure. I remember going to a group supervision session where we talked about like our takeaways or our themes of what we were learning.
Mhm.
And thanks to that supervisee, we were able to bring that in. I started giving all my supervisees that option of using that, and found that was really helpful. So being open to that feedback is so useful. And I guess in a way you have the opportunity to train your clients and to welcome feedback. So instead of saying, oh, this isn't a good fit, I'll go to a different therapist, they could actually give you the feedback and you can adapt, and it can become a better fit. Well,
Absolutely.
Drian, I know you have another client to get to, so
I
I
do.
thank you so kindly. It's been such a blessing to be able to talk with you and connect, and uh, have students be able to continue to learn from your experiences as someone who's immersed in this field. So thank you so much for being here today. And For those watching, I hope that I hope this gives you some concepts to contemplate. Until next time.
Will do. Thank you for having me.